Exercise can boost the effects of a healthy diet, but it cannot make up for a poor one. In fact, of the two components, diet and exercise, the diet portion is much more important for weight loss and ultimately for preventing or controlling diabetes. Today I'm presenting to you my highlights of Dr. Neil Barnard's Program for Reversing Diabetes, the scientifically proven system for reversing diabetes without drugs. A new approach to diabetes. When this book first appeared, the idea that diabetes could improve dramatically and sometimes even go away for all intents and purposes was a novel concept. The prevailing notion was, once you have diabetes, you'll always have diabetes, and the condition just seemed to lead to more and more complications. We will focus on changes in your menu, not on drugs. Yes, medications often have their role, but I would much rather help you scale back on drugs, or eliminate them entirely. Doing that means rethinking the foods that you eat. Let me emphasize that you will not need to cut calories, limit carbohydrates, or stick to small portions. In fact, you can eat until you are full. If you get hungry between meals, you are free to eat more. What we will zero in on is the type of food you eat. Unlike with medication treatments, the side effects of the menu change are good ones: weight loss, lower cholesterol levels, lower blood pressure, and increased energy. It became clear that the diet shift actually caused a fundamental change in the body itself. In 14 weeks, the diet led to a 24% improvement in insulin sensitivity, that is, the body's ability to respond to insulin, the sugar-storing hormone that is dysfunctional in diabetes. Participants whose blood sugar levels were in the abnormal range saw them promptly return to where they belonged. While exercise could increase the benefits even further, diet changes alone were powerful enough to boost insulin sensitivity and bring blood sugar under better control. Type 1 diabetes is much less common than type 2. It is usually diagnosed in childhood and is invariably treated with insulin, hence its former names childhood onset diabetes and insulin-dependent diabetes. Unlike people with type 2 diabetes, those with type 1 always need to take insulin. But they can use diet and lifestyle changes to keep doses to a minimum and reduce the risk of complications. The process that leads to type 1 diabetes begins when the body's immune system attacks the insulin-producing cells of the pancreas. This program is designed to help you understand the cause of diabetes and how to correct it to the fullest extent that diet and lifestyle changes possibly can. If you do not have the disease but are at risk, this is a powerful program for preventing it. The new basics. Diabetes may arrive with no symptoms at all, but often it starts with fatigue. For no apparent reason, your spark is just no longer there. It may also seem that you are losing water more rapidly than you should be, which is to say that you make trips to the bathroom more often than usual. And you are thirsty. You find yourself drinking a surprising amount of water. The fundamental problem is that sugar is not able to pass from your bloodstream into the cells of your body. The sugar we are speaking of is glucose, one of the smallest and simplest sugar molecules. In this case, sugar is not just another word for junk food or empty calories. The fact is that the cells of your body use this kind of sugar, glucose, as an energy source. If glucose is unable to enter your cells, they are deprived of their basic fuel, so you lose your energy. That is why you are fatigued. If your muscles do not have the glucose they need for power, you tire easily. Meanwhile, the glucose that cannot get into your muscle cells builds up in your bloodstream. It becomes more and more concentrated in the blood, and eventually it starts to pass through the kidneys and ends up in your urine. Now, as glucose passes through your kidneys, it carries water along with it, lots of water, hence all those trips to the bathroom. What follows naturally is thirst. You are losing all those fluids. So fatigue, frequent urination, and thirst are all symptoms of one problem. Glucose is having trouble getting into your cells. You may also find that you are losing weight. And no, this is not an especially welcome event, not in this situation. You lose weight because your cells are in essence starving. Nutrients cannot enter your cells, so your body is malnourished. An overly large amount of glucose flooding through the bloodstream day after day can harm the arteries. Left unchecked, it can damage the heart and the delicate blood vessels of the eyes, kidneys, and extremities. A diagnosis of diabetes or prediabetes means the insulin in your body is not doing its job adequately. Insulin is a hormone that moves sugar from your bloodstream into the cells of your body, among other functions. It acts like a key, opening a door to the cell, so to speak, and allowing nutrients inside. If for some reason your body is not making insulin, the result is rising blood glucose levels. Similarly, your blood glucose rises if your cells resist insulin's actions. The key goes in the lock, but the door will not open. In type 1 diabetes, something has damaged the pancreas's ability to produce insulin, and you need to get it from an outside source, typically by injection. However, research has revealed a great deal about how diet changes can reduce the risk that diabetes will bring any serious complications your way. About 9 out of 10 people with diabetes have type 2. Most people with this form of the disease still produce insulin. The problem is that their cells resist it. Insulin tries to bring glucose into the cells, but the cells respond like a door with a malfunctioning lock. In response to these sluggish cells, your body produces more and more insulin, trying to overcome the resistance. If the body's insulin supply cannot overcome the resistance, glucose simply builds up in your blood. Prediabetes is the term used when your blood glucose level is higher than normal, but not high enough for a diagnosis of diabetes. For most people, it means that you have insulin resistance and are on your way to developing type 2 diabetes, unless you take steps now to improve your health, especially through changes in your eating habits. Insulin is made in the pancreas, an organ located just behind your stomach that is about the size and shape of a TV remote control. Some genes are dictators and others are not. The genes for hair color or eye color, for example, really are dictators. If they call for you to have brown hair or blue eyes, you can't argue. But the genes for diabetes are much more like committees. They do not give orders, they make suggestions. If your genes call for diabetes, we do not necessarily have to listen to them. We have more control than you might imagine. Reversing type 2 diabetes. Sooner or later, you and your doctor are likely to decide that the diabetes diet is not helping very much, and your doctor will add various drugs. You may need 1, 2, or even 3 different oral medications. Eventually, your doctor may consider adding insulin injections. And because many people with diabetes also have high blood pressure or high cholesterol levels, doctors often add medications to tackle these problems too. Instead of helping you reduce or avoid medications, the diet seems to be a stepping stone on the way to an ever-increasing list of drugs. People in countries where diabetes was uncommon were not following anything like a diabetes diet. They did not avoid carbohydrates. They ate starchy foods every day. In Asia and Africa, rice and other grains, starchy vegetables, bean dishes, and noodles are staples. Carbohydrates do not cause diabetes, and a diet that focuses on keeping carbohydrates out of your diet is not a powerful way to manage, let alone reverse, the disease. If anything, healthy complex carbohydrates help prevent it. Think about what happens when an Asian man or woman switches to a Western lifestyle. Hamburgers, fried chicken, cheese, and other Western fare come into the diet, while rice and noodles are gradually forgotten. The diet becomes fattier and much higher in protein, while carbohydrate-rich rice and noodles and other starchy foods fall by the wayside. The inescapable fact is that the problem is not carbohydrates, that is, sugar and starch. The problem is in how the body processes them. If we can repair your body's ability to absorb and use carbohydrates, not only can you enjoy healthy carbohydrate-rich foods without worry, but diabetes itself ought to improve, perhaps even go away. Imagine the workings of a lock on a typical door. What if someone were to jam chewing gum into the lock? There's nothing wrong with your key and really nothing wrong with the lock, except that it is now filled with gum. To make it work again, you need to clean it out. The new approach to diabetes is based on cleaning out your biological locks. Our goal is to help your insulin key work the way it is supposed to. Several years ago, my research team began a series of studies to see what diet alone could do. We tested a diet that focused not on limiting carbohydrates, but rather on getting as much fat off the plate as possible. We thought if we could do that, perhaps we could clean out the lock mechanism that opens the cell doors. Most of the participants were surprised to see rice, pasta, sweet potatoes, and beans on the menu, and even more surprised that the diet did not limit carbohydrates at all. No matter how long they had had diabetes or how nervous they felt about the idea of putting carbohydrates back onto their plates, we put no limit on carbs at all. There was also no limit on portions. Most of our participants were overweight, but even so, we did not ask them to limit portions or cut calories. What we zeroed in on was fat. We aimed to clean all the grease out of the participants' diet. At the end of the study period, everyone weighed in. In just 12 weeks, the average participant had lost 16 pounds. Their fasting blood sugar had dropped 28%. 2/3 of the participants on diabetes medications were able to reduce or discontinue them in that short period of time. All this occurred without any limits on calories, portions, or carbohydrates, and without exercise. What was happening was that the diet had made their cells more sensitive to insulin's actions, so they were able to take in nutrients more quickly. Glucose got out of the blood and into the cells, where more of it could be burned up, so to speak. These calories are released as body heat rather than being stored as body fat. Scientists call this the thermic effect of food, and it provides a small extra edge for weight loss. The combination of the diet and the blood sugar lowering drugs was so powerful, however, that many participants had to reduce their doses or discontinue medications altogether to keep their blood sugar from dropping too low. The patient's coronary arteries, which had been blocked by years of poor diet, were actually starting to open again. The difference was clearly visible in 82% of the patients after 1 year. This occurred without surgery or drugs, even without cholesterol-lowering medication. Other researchers have shown that this same sort of diet change reduces blood pressure. Apparently, eliminating animal fats reduces the viscosity, thickness of the blood. That is, the blood becomes less like grease and more like water, so it easily flows through the arteries, causing blood pressure to fall. Blood pressure is also reduced by the potassium in vegetables and fruits, and other characteristics of plant foods augment this benefit. I have described each cell of the body as being rather like a gummed-up lock. Research has shown this analogy to be surprisingly apt. Indeed, insulin's ability to work is blocked by the accumulation of something within the cells, not gum, but fat. Muscle cells normally store a tiny amount of fat, which provides an energy source for physical activity. The amount is normally quite small, and the fat simply waits for that day when you are much more active than usual and need a bit of extra energy. For some reason, in these young people, fat had built up much more than it should have, to levels 80% higher than in other young people. The fat buildup had reached the point where it was gumming up the lock. The fat inside your cells is different from the fat around your waistline. Even if you are quite slim, you may still be accumulating fat within your muscle cells. Scientists call them intramucellular lipids. Intra means inside, myo is muscle, and lipid is fat, literally fat inside muscle cells. As you have seen, these traces of fat start accumulating many years before diabetes manifests. If all is operating normally, fat enters the cell and these tiny burners use it up. These burners are called mitochondria, and they are responsible for turning fat or other fuel sources into energy to power your muscle cells. If you are steadily accumulating fat, that is a sign that your burners, your mitochondria, are falling down on the job. In type 2 diabetes, the problem appears to be too few mitochondria. That is, people with type 2 diabetes have fewer mitochondria than they need to burn up the accumulating fat. If they had more of these little furnaces inside each cell, things would be very different. Surprisingly enough, it may be that the number of mitochondria you have depends on what you eat. Those fatty foods actually seem to disable your genes that would produce the mitochondria you need to burn up this accumulating fat. Your ability to eliminate fat inside your cells seems to be slowed down when you eat fatty foods. Our human ancestors did not find fatty foods growing on trees, or at least not many of them. On the rare occasions when they ate fatty foods, meat, eggs, nuts, or avocados for example, their bodies may actually have tried to save some of the fat from these foods in the case they needed it to power their muscles or food became scarce. Thus, it would not be surprising if a sudden influx of fat in the muscle cells signals them to turn off the fat-burning mitochondria and save the fat for future needs. The fat inside your cells is not a permanent fixture. If the influx of fat stops, the fat inside the cells dissipates, and when that happens, the cells start to regain their normal function. After 14 weeks on the experimental diet, it was clear that the participants had a significant increase in their after-meal calorie burn. Their after-meal calorie burning speed increased by 16%. A revolution in type 1 diabetes. Gaining control over your blood glucose makes an enormous difference. Now with type 1 diabetes, you will need to use insulin to achieve that goal, but diet and exercise offer additional power that too few people take advantage of. There is a special advantage to a vegetarian diet, or should I say a vegan diet, meaning a menu that includes no animal products at all. Dietary cholesterol is found only in animal products. Animal products also tend to be high in the saturated bad fat that tends to cause your body to make additional cholesterol, an effect that is actually much greater than eating cholesterol itself. Identical twins, of course, have exactly the same genes, so they have the same hair color, eye color, and facial features. If a disease were simply genetic, then both twins would have it. But type 1 diabetes does not work that way. As I mentioned in Chapter 1, if one twin has diabetes, the other has less than a 40% chance of developing it. The complex defense network of your immune system is made up of specialized white blood cells. Some of these cells engulf invading germs and digest them. Others make antibodies, molecules that attach to invading organisms like harpoons and identify them for other immune cells to attack. If you have type 1 diabetes, your immune system has made a major error. It has attacked and destroyed your insulin-producing cells, resulting in what scientists call an autoimmune disease. Examining blood samples from 142 children newly diagnosed with type 1 diabetes, they found that each of the children had antibodies that were primed to attack cow's milk proteins. These antibodies had apparently arisen in response to cow proteins in their infant formula, but the antibodies were also capable of attacking the body's insulin-producing cells. It turned out that a portion of the cow's milk protein was biochemically an exact match for a portion of human insulin-producing cells. The antibodies that arose to destroy the cow's milk protein ended up attacking the children's insulin-producing cells. The pancreatic cells were destroyed by friendly fire. The researchers believed that the mature digestive tracts of adults would not allow these dairy proteins to pass through the intestinal wall and into the bloodstream, but in infants, the molecules pass through more easily. The risk of diabetes can very likely be reduced if infants are not exposed to cow's milk proteins early in life. For decades, we have known that some cow's milk proteins ingested by a nursing mother end up in their breast milk. They come from her digestive tract, are absorbed into her bloodstream, and find their way into the breast milk, sometimes making babies colicky. Thus, in order to avoid exposing babies to dairy proteins, it is important to eliminate them not only from infants' diets, but also from the diets of their breastfeeding mothers. Breastfeeding instead of feeding formula poses no risks for children. Quite the opposite. Breastfed babies gain many advantages, including better overall health and even a few extra IQ points compared to their formula-fed counterparts. And the most healthful breastfeeding is done when mothers follow a diet free of foods that can harm their babies. A powerful new menu. There are no limits on portions, calories, or carbohydrates. You will focus on what you eat, so how much you eat generally takes care of itself. To reverse the cause of diabetes, clean the gum out of the logs, and allow the heart and blood vessels the best chance of reversing any existing blockages, there are 3 guidelines. 1. Set aside animal products. 2. Keep vegetable oils to a minimum. 3. Favor foods with a low glycemic index. Following this guideline means purging the animal fat from your diet. The program you are about to start omits meat, dairy products, and eggs. The plan does have guidelines about carbohydrates, but they relate mainly to which ones are the best choices, not how much you put on your plate. In our studies, we have found that people who include plenty of healthy carbohydrates in their diets do better, not worse. You will notice that when you avoid animal products, your diet is not just free of animal fat, it is also free of animal protein. That is important because animal protein can harm the kidneys, and protecting them is a key goal. Protein from plant sources is the way to go. The idea is simple. Build your diet from 4 healthy staples: whole grains, legumes, vegetables, and fruits. Whole grains are filling but have very little fat and no cholesterol. When selecting grains, let the glycemic index guide you to the best choices. How many servings should you have from each group? You can vary your serving sizes as much as you like. If you prefer Mediterranean cuisine, your plate may be rich in vegetables and pasta. If Asian food is your thing, your plate may hold generous portions of rice or other grains. If you love Latin American foods, you might go for bean dishes. If you come from a typical North American background, you will probably want a variety of all 4. Other permitted foods: fat-free salad dressings and other fat-free condiments. Coffee with fat-free non-dairy creamer if desired. Occasionally, alcoholic beverages. Rarely, sugar, nuts, seeds, dark chocolate made without milk, full-fat soy products such as tofu, tempeh, soy cheese, etc. Foods to avoid: meats, poultry, fish, eggs, whites and yolks, and all dairy products, regular and fat-free, including milk, yogurt, cheese, ice cream, cream, sour cream, butter, etc. Added oils, such as margarine, salad dressings, mayonnaise, cooking oils, etc. Fried foods, such as potato chips, French fries, onion rings, donuts, etc. Avocados, olives, and peanut butter. Foods with high GIs, such as white bread or white potatoes. Although foods will give you most of the nutrition you need, 2 supplements are important: vitamin B12 and vitamin D. Vitamin B12 is essential for healthy nerves and healthy blood, and vitamin D is important for your bones and may reduce cancer risk. Cow's milk derives, believe it or not, 49% of its calories from fat. That is a lot by any standard. You may imagine that 2% milk is much lower in fat. Not so. That 2% figure refers to fat content by weight, which is deceptive because it is thrown off by milk's water content. When you drink a glass of milk, your body absorbs that water. What matters for your health is how much fat you are left with. Nutritionists look for the percentage of calories that come from fat because that figure is unaffected by water content. It turns out that for 2% milk, about 35% of calories come from nothing but fat. When the fat is skimmed away, the predominant nutrient in milk is actually sugar, lactose, the dairy sugar. The lactose molecule is a combination of two smaller sugars, glucose and galactose. Approximately 55% of the calories in fat-free milk come from lactose. Can there really be all that fat, cholesterol, and animal protein inside a single egg? Certainly. Keep in mind that when an egg hatches, a baby chick emerges. That chick's body, legs, wings, skin, feathers, internal organs, and everything else was formed from what was inside the egg when it was laid. So it was loaded with cholesterol and other things you do not want. Like all animal products, eggs have no fiber at all and no complex carbohydrate. Vegetable oils do enjoy a better reputation than animal fat, and indeed they have less saturated fat, the kind that raises cholesterol levels. All fats and oils are loaded with calories. They have 9 calories per gram, which is more than twice the calorie content of carbohydrate or protein, 4 calories per gram. Thus, when it comes to calorie content, vegetable oils are as fattening as lard. If your goal is to regain as much insulin sensitivity as possible, you will want to eliminate not only animal fats but also added vegetable oils. Cleaning the animal fat out of your cellular locks does no good if you are going to clog them with a vegetable grease. When it comes to avoiding greasy foods, some people are eager to make an exception for olive oil. It seems natural and even chic. But think for a second about how factories manage to fill a bottle with oil. They take an enormous number of olives, discard their fiber and pulp, and leave you with the fat. While olive oil contains a great deal of monounsaturated fat, which has little or no effect on cholesterol, it also contains saturated fat, about 14%, the kind that increases cholesterol and worsens insulin resistance. It does not matter how expensive the oil is or how extra virgin it may be. It still has more calories and saturated fat than your body is designed to process to maintain optimal health. A few plant foods such as nuts, seeds, olives, avocados, and some soy products are naturally high in oil. If you are trying to lose weight or tackle diabetes, you will want to avoid them. Beans, vegetables, and fruits are very low in fat overall, but the traces they do contain are relatively rich in good fat, that is, alpha-linolenic acid. This is the basic omega-3 fat that your body uses to produce other good fats. Nuts, seeds, and soy products contain larger amounts. Linoleic acid is found in many plant foods too. A food with a high GI releases sugar into the blood quickly. One example is white bread. If a molecule of carbohydrate in bread was greatly magnified, it would look like a string of beads. Each bead is a molecule of sugar, glucose. In your digestive tract, these beads separate and pass into your bloodstream. With white bread, this process is quick. The string of beads rapidly disintegrates, and the individual glucose molecules race into your bloodstream. If you were to do an online search for information about the glycemic index, you would soon discover a mind-numbing array of tables from a variety of sources, none of which agree with each other. That is because the GI of any food can vary depending on the brand, how it was prepared, and other factors. Sometimes people with type 2 diabetes shun carbohydrates. They avoid rice, beans, pasta, and all the rest, and load up on chicken, fish, and eggs because these foods have no carbohydrate. But over the long run, they find their blood sugar does not improve, their levels get worse. So they need more and more medicine. It makes sense when you think about the fact that these foods contribute a load of fat and aggravate the accumulation of fat in cells, more gum in the logs, so to speak. Greasy meals today mean insulin resistance tomorrow. It may surprise you to learn that pasta has a low GI. It does, particularly if it is served al dente, that is, not overcooked. Of course, pasta is made from wheat flour, so you may think it would spike your blood sugar in the same way as wheat bread. But that is not the case. Pasta actually gives us a little lesson in why some foods have a high GI while the GI of others is low. Even whole wheat bread with shreds of fiber remaining is easy pickings for digestive enzymes. They have no difficulty entering the air pockets and digesting the starch in the bread. The take-home lesson is that processing foods, pulverizing grains into flour or using yeast to make dough rise, for example, starts the digestive process before you even put the food on your plate. An intact grain is slow to come apart and release glucose into your bloodstream, while a heavily processed grain is likely to disintegrate quickly. Thus, old-fashioned oatmeal, which consists of whole oats, has a low GI. But quick-cooking oatmeal is made by slicing the oat grains into fragments. That allows it to cook faster and to digest faster, which means a higher GI. Choosing low GI foods reduces hemoglobin A1c by 0.3 to 0.4 percentage point. In some studies, the difference was as much as 0.6 point. Fruits, vegetables, beans, and grains provide the healthy nutrition you need. Eating these foods, you are much better nourished than you would be on a meaty, dairy-filled diet, because these healthy plant-based foods are rich in fiber, vitamins, and other plant-based nutrients, while helping you skip unhealthful fats and cholesterol. The best source is a vitamin B12 supplement, which you will find at any drugstore or health food store, and you should take it daily. The dose is not especially important because all common brands have more than the recommended daily allowance, and even high doses of B12 do not appear to be dangerous. If you get plenty of sun, you do not need any vitamin D in your diet. But if you do not get regular sun exposure, a vitamin D supplement is important. A reasonable daily dose is 2000 IU. How can you lose weight if you are paying no attention at all to portion sizes, calories, and carbohydrates? There are three main reasons. First, the foods have very little fat, so you are eliminating the main source of unwanted calories. Second, the vegetables, fruits, beans, and whole grains you are bringing into your diet give you a healthy dose of fiber, which is filling enough to turn off your appetite a bit sooner than would happen without them. On average, each 14 grams of fiber cuts about 10% off your calorie intake. A person who normally eats 2000 calories per day and then starts to add an extra 14 grams of fiber daily will tend to feel full after eating 1800 calories. Third, these foods cause a slight boost in your after-meal calorie burn. Normally, you burn calories faster after a meal due to the process of digestion. Our studies have shown that a low-fat vegan diet increases this after-meal burn, giving you an extra edge. A team of California researchers used a low-fat vegan diet combined with exercise in a group of 21 people with type 2 diabetes, all of whom had painful neuropathy, the nerve symptoms that arise as the nerves are damaged. In just 2 weeks, 17 of the 21 reported complete cessation of their nerve symptoms, and the remaining 4 had noticeable improvements. Most of us tend to stick to our favorite meals. We may have 4 or 5 different dinners we like, and we pick from that repertoire night after night. All you need to do is to find healthy meals that suit your tastes, and you are set. A diet change really is like getting into a swimming pool. If you ease your way into the water bit by bit, it is a painful process. But if you plunge in, very soon you see that the water feels fine. You are making a big change, and you are likely to wonder whether you are missing out on anything. Let me offer a word of reassurance. If you choose your meals from a variety of whole grains, legumes, vegetables, and fruits, and take my advice about vitamin B12 and vitamin D above, you will have your bases covered. Your body uses protein to build and repair body tissues. Proteins are made up of small molecules called amino acids. All the proteins in your skin, muscles, bones, and internal organs are built from various combinations of about 20 different amino acids. A healthy diet of beans, grains, vegetables, and fruits provides all the protein you need. In fact, you are better off getting protein from plant sources. While animal protein can be hard on the delicate tissues of the kidneys, plant proteins appear to be free of this problem. They are also free of the risks of calcium loss and kidney stones associated with animal protein. Animal protein tends to cause calcium to pass through the kidneys and into the urine. In the process, calcium is not only lost, but it ends up in your urinary tract where it can cause stones. Milk's benefits are, for the most part, a myth. Studies do not show much benefit for the bones from drinking milk. How can that be? Well, only about 1/3 of milk's calcium is absorbed by the body. The other 2/3 simply passes out with the wastes. In addition, milk contains animal protein and sodium, both of which tend to increase calcium loss through the kidneys. Studies of high-protein diets, such as the Atkins diet, dramatically demonstrate the losses. Such diets increased calcium loss by more than 50%. It is also important to limit sodium, salt, and get vitamin D from either sunlight or supplements. Vegetables and fruits promote bone strength for reasons that are not entirely clear, and exercise gives your bones a reason to live. You need iron to build hemoglobin, which your red blood cells use to carry oxygen from your lungs to your body tissues. But too much iron can be toxic. It can increase the risk of heart problems and may even worsen insulin resistance. Iron encourages the production of unstable molecules called free radicals, which can damage your body's delicate tissues and are linked to heart disease, cancer, and even certain aspects of the aging process. The most healthful iron sources are the same foods that bring you calcium: beans and green leafy vegetables. They are rich in iron but carry it in a special form called non-heme iron. Your body easily absorbs this form when it's in need of more iron, but the iron passes harmlessly out of the body when you have all you need. In contrast, meat contains heme iron, which is like an uninvited guest at your party. It barges in whether you need it or not. Over the long run, meat eaters tend to accumulate too much iron. Zinc plays important roles in immune function, wound healing, and many other biological functions. But as with iron, you can have too much of a good thing. The most healthful sources include legumes, nuts, and fortified breakfast cereals. Your body's actual fat requirement is minuscule, as you saw earlier. Most people in Western countries get many times the needed amount. Nuts, seeds, avocados, olives, and full-fat soy products are also high in fat. Although they are low in saturated fat, the overall amount is high, and you should limit these foods accordingly. How to get started. Most of our research participants make old-fashioned oatmeal a part of their morning routine, and for good reason. Oats are rich in soluble fiber, the kind that gets creamy in water and removes cholesterol from your body. Wheat and rice are high in insoluble fiber. Generally speaking, old-fashioned oatmeal is better than instant or one-minute varieties, although even these quick-cooking versions are far better than bacon and eggs. The more intact the grain, the lower the GI, and the longer the cereal keeps you satisfied. Here's why starting with a high-protein food can be helpful. Starchy or sugary foods naturally increase the production of serotonin, the same feel-good chemical that is boosted by antidepressants such as Prozac and Zoloft in the brain. Now that's a nice benefit, but for some people the result is post-breakfast drowsiness. In fact, some people actually use starchy foods as a remedy for insomnia. A high-protein food blocks the serotonin-producing action, boosting your energy. Any high-protein food will do. Veggie sausage, veggie bacon, scrambled tofu, beans, or even a spoonful or two of chickpeas. Aim to keep your total daily sodium intake to less than 1500 milligrams. Dried fruits are acceptable. Surprisingly, their GIs are not necessarily higher than those of fresh fruit. Because their water has been removed, however, it is easy to take in far more calories with dried fruit than with fresh fruit, so it pays to favor the fresh varieties. Nutritionally, frozen vegetables are equivalent to fresh. Sometimes people want to make exceptions for foods that sound as if they are healthful. Honey, for example, has gotten unjustified good press over the decades. Nutritionally speaking, it is simply sugar, offering you nothing from a health standpoint. Rather like olive oil, its marketing has gotten way ahead of its value. If some not so healthful items from your previous diet are still lurking though, what do? That's easy, get rid of them. Do not use them up because they will continue to cause problems for you. Toss them. Once you have picked your time, jump in with both feet. Do the diet change 100%. Follow our 3 guidelines as closely as humanly possible and do it all the way. Healthful weight control. There are a great many ways to lose weight. Cutting calories works for some people, but others find it a real challenge. If you normally eat 2000 calories per day, for example, a common recommendation would limit you to 1500, and that gets old very fast. If you're hungry at 8 in the evening and you've already had your 1500 calories for the day, you will go to bed hungry. That will never happen on the program recommended in this book. A healthy approach to weight loss focuses on choosing the right kinds of foods, not the quantity of food you eat. When you have the right foods on your side, the calories and portions fall into line on their own, and weight loss is almost automatic. Every 14 grams of fiber added to your daily menu cuts calorie intake by about 10% on average. That simply means that high-fiber foods fill you up faster, so you stop eating sooner. Instead of trying by sheer force of willpower to cut calories, you cut them without even thinking about it. The richest sources of fiber are beans, vegetables, fruits, and whole grains. While breakfast cereal commercials tend to push grains as the best fiber source, you will find much more fiber in beans and most vegetables than in most grains. But they all add up. Aim for at least 40 grams per day. Surprisingly, what makes us stop eating does not seem to be the number of calories we have ingested, nor is it the amount of carbohydrate or protein in a meal. Rather, it is the weight of food we have taken in. It is as if your stomach has a scale, and once it registers a certain number of grams of food, it signals your brain that you have had enough. There's an easy way to check the energy density of commercial food products. Just take a look at the label. If one serving has fewer calories than grams, it is a good choice. For example, the label on a can of black beans shows that a serving has 90 calories and weighs 122 grams, so the beans are a good choice. Sometimes when people blame carbs for their weight problems, they are thinking of cookies and cupcakes. But if you have ever looked at recipes for these products, you know that an enormous load of fat, typically from butter or shortening, is usually lurking inside. The low-fat diet trimmed away roughly twice as much body fat compared with a low-carb diet. Low-carb diets can cause weight loss over the short run, but there are far healthier ways to achieve that goal and to make weight loss last over the long run. Our bodies seem to have different plateaus depending on the fat content of our foods. That is to say, if you drop the fat content slightly, your weight will probably drop a bit, then plateau. If you drop the fat content more, you'll drop down to a new plateau. How to test yourself and track your progress. If you have type 1 diabetes or are using insulin for type 2 or gestational diabetes, you should check your glucose at least 3 times a day or according to whatever schedule your doctor recommends. The combination of a powerful diet and the diabetes medications you may already be on can be very strong. In fact, your blood glucose can fall so low that you start to shake and sweat. See below for other symptoms. This is called hypoglycemia. Symptoms of hypoglycemia include shaking, sweating, hunger, anxiety, weakness, rapid heartbeat, dizziness or lightheadedness, sleepiness or confusion, difficulty speaking. If you experience these symptoms, check your blood sugar. If it is below 70 milligrams per deciliter or 3.9 millimole per liter, or whatever other benchmark value your doctor recommends, you need to eat something that raises your blood sugar quickly. Hypoglycemia does not mean there's anything wrong with your diet. Rather, it means that the medication regimen you are on has become too strong for you. Having some up and down swings in blood sugar is normal, but if your glucose remains high day after day, your risk of complications is higher than it would be if your glucose levels were better controlled. The American Diabetes Association recommends that people with diabetes use the following guidelines for blood glucose levels. Fasting or before meals, 80 to 130 milligrams per deciliter, 4.4 to 7.2 millimole per liter. 1 to 2 hours after a meal, below 180 milligrams per deciliter or 10 millimole per liter. Glucose is vital to your body's functioning, especially to the workings of your brain. So your body has a way of increasing your blood glucose when it gets a bit low. In the early morning hours, typically between 5 and 9 a.m., hormones, growth hormone, cortisol, and catecholamines cause your liver to release glucose into the bloodstream. Your A1c level should be checked every 6 months or every 3 months if your diet, medications, or general health is changing, or if previous values have been too high. If your A1c is high, your doctor will be concerned, and you should be too. If it is low, you are doing well. To give you a frame of reference, the American Diabetes Association says that most people with diabetes should keep their A1c below 7%. High levels of cholesterol in the blood can damage your heart, major blood vessels, and the delicate blood vessels of the eyes and kidneys. The average cholesterol level in the United States is hovering around 200 milligrams per deciliter. And in a country where heart attacks are the cause of death for half the population, you do not want to be anywhere near average. In large population studies, it is clear that the lower your cholesterol, the lower your risk of heart problems until you reach a threshold of about 150 milligrams per deciliter or 3.9 millimole per liter. Maintaining healthy blood pressure is extremely important. As you can imagine, increased pressure inside your arteries can damage the arteries themselves, as well as your heart, eyes, kidneys, and nerves. The longer your blood pressure stays high, the more damage it can do. Normal blood pressure is less than 120 over 80 milliliters of mercury. If you have high blood pressure, your caregiver will work with you to reduce it to below 140 over 90 and to below 130 over 80 if you can get there without serious medication side effects. Because your kidneys can easily be affected by diabetes, your doctor will check your kidney health with a simple urine test at least once a year. The goal is to see whether your kidneys are losing protein, specifically a protein molecule called albumin. Albumin itself is not especially important. What is important is that if it shows up in your urine, It is a sign that your kidneys have been affected by diabetes and are not holding on to albumin as they should. Do not rely on exercise alone for weight loss. A healthful diet change can easily trim 300 to 400 calories a day off your daily menu. But burning that many calories through exercise means walking or running 3 or 4 miles a day. Exercise is important, but it cannot begin to take the place of diet changes. A perfect diet in an imperfect world. I suggest that you not fix healthy meals for yourself and less than healthy meals for your spouse or children. Some people do this figuring they cannot change others' bad habits. But remember this, not only will introducing healthful foods to your family bring you some very important allies, it will benefit your loved ones as well as you. Troubleshooting. Because this is not a short-term starve-yourself-thin diet, it does not cause hunger, so there is no rebound binging. Gradual, healthy weight loss is what you can expect. Sometimes losing weight can be a bit like following the stock market. There are fluctuations up and down, but the trend should be clear. Exercise is beneficial and I strongly recommend it. But a lack of exercise is not the primary reason for weight problems, and exercise can never take the place of a healthful diet. Meals will always cause a temporary rise in blood glucose. What you are looking for is an overall trend downward as your insulin sensitivity gradually improves. Stress raises blood sugar. The fight or flight response, the physical reaction that gets you ready to fight or run away from danger, can kick in with any sort of threat, real or imagined. A rise in blood sugar was much more useful when the threats we encountered were predators and warring tribes. That extra blood sugar fueled the muscles needed to run or fight. One of the reasons I recommend a low-fat vegan diet is that it is so substantial. It provides plenty of fiber to fill you up and has no limits on portion sizes or calories. The result is weight loss without hunger. You want foods that have both a low GI and high fiber content. Experiments show that sugar does not simply delight the taste buds, it also stimulates the release of opiate chemicals in the brain. Just as intense exercise causes the release of endorphins, natural feel-good chemicals within the brain, sugar seems to do something very similar. Let me be clear about this. Sugar does not contain opiates. Rather, the taste of sugar on the tongue is what apparently triggers the release of opiates within the brain. In turn, these opiates trigger the release of another natural chemical called dopamine, which is the key to the brain's pleasure centers. Chocolate also contains caffeine, theobromine, and phenylethylamine. These are all stimulants, and they may play a role in chocolate's seduction aside from its opiate effects. Alcohol, recreational drugs, tobacco, and yes, unhealthy foods cause significant dopamine release. So not only do you like them, you also want to have them again and again. Your pleasure center rearranges your priorities to favor whatever stimulated it most recently. You find yourself planning your day around sugar or chocolate, just as an alcoholic might regularly think about where the next drink is coming from. If you have ever wondered why these otherwise banal foods have such sway, it is because they hijack your brain's pleasure circuitry and your internal priority setting system. We found that nearly half of our research participants with type 2 diabetes had the gene that was associated with fewer than normal dopamine receptors. That is far higher than the roughly 1 in 5 prevalence in the general population. Regardless of your genetic makeup, the diet described in this book is very likely to help you. I raised the issue of genetics simply to underscore the point that cravings and food addictions are physical, not moral issues. They are due to the properties of food themselves that interact with our natural biochemistry. If certain foods act like drugs, it pays to treat them like drugs. In other words, avoid them. The brain cell at the top contains small packets, vesicles of dopamine. When you experience a pleasurable sensation, these vesicles release their dopamine into the space, synapse, that lies between that cell and the next one. As the dopamine molecules reach the next cell, they attach to its dopamine receptors, and their effect depends on how many dopamine receptors you have. Some people have approximately 1/3 fewer receptors than other people. Triglycerides are molecules of fat that are transported in the blood for various purposes. As with cholesterol, having a certain amount of triglycerides in the blood is a normal part of human biochemistry. However, when triglycerides are high, they increase the risk of heart problems, diseases of the pancreas, and other problems. As you saw in Chapter 7, a normal triglyceride concentration is less than 150 milligrams per deciliter. Some studies have suggested that diets high in refined carbohydrates may cause a temporary rise in triglycerides. High fiber and low GI foods appear to have the opposite effect. Which supplements should you take? If you follow a vegan diet as I recommend, you should take a daily vitamin B12 supplement that provides at least 5 micrograms. Nearly all brands contain more than this, but higher doses are not toxic. Vitamin D is produced when your skin is exposed to sunlight. It helps you absorb calcium, among other functions. It is a good idea to spend 15 to 20 minutes daily outdoors. If you get this sun exposure, there is no need for dietary supplementation. If you do not, and also do not take a regular multivitamin, a 2000 IU vitamin D supplement is a good idea. Cinnamon has been shown to improve blood sugar levels. As little as 1/2 teaspoon of ordinary cinnamon added to your morning oatmeal or other foods not only seems to reduce blood sugar, but also appears to reduce blood cholesterol levels. Some of cinnamon's helpful effects may be explained by compounds called polyphenol polymers, which are found in the spice and have an insulin-like action. While you are making sure to include chromium-rich foods in your menu, it may also help to steer clear of sugar and refined grain products, such as white flour. These foods are not only low in chromium, they also increase chromium loss from the body. Loss of the mineral is also increased by the stresses of infection, strenuous exercise, and pregnancy. Exercise for the rest of us. If you cannot exercise because of a physical limitation, you can still lose weight, cut your blood sugar, and live a healthy life. In fact, most of the benefits of the diet changes you have read about came without exercise. Exercise can boost the effects of a healthy diet, but it cannot make up for a poor one. In fact, of the two components, diet and exercise, the diet portion is much more important for weight loss and ultimately for preventing or controlling diabetes. A careful review of published research showed that people who begin exercise programs do not lose much more weight than people who remain sedentary. For weight control, exercise cannot take the place of diet changes. Exercise helps you sleep. If you have given your muscles a good workout, they demand sleep. You will sleep much more soundly than if you had spent the entire day behind your desk, watching television or reading. And when you are well rested, it is easier to stay focused on a healthy diet and say no to unhealthy foods. Exercise makes you feel better. It lifts your spirits and is a natural antidepressant. Some people were born to exercise. That is to say, their muscles naturally contain many type 1 cells. The name has nothing to do with type 1 diabetes. It is just a coincidence. These muscle cells have a particularly strong blood supply made possible by a rich network of capillaries that bring in oxygen and reduce fatigue. They also have an extra supply of an enzyme called lipoprotein lipase, which breaks fats apart to be used as fuel. The result is extra energy for a long run. Other people's muscles contain mostly type 2 cells, which are fine for short bursts of exercise, but have less endurance for the long haul. Muscles can change, at least to a degree. If you gradually but steadily increase the intensity of your workouts within the limits of safety, the blood supply to type 2 cells increases. Eventually, they become almost as vigorous as type 1 cells. It is important to exercise regularly rather than intermittently. To paraphrase Newton's first law of motion, an object at rest tends to stay at rest, and an object in motion tends to stay in motion. A single exercise session every now and then will not help you any more than occasionally eating a healthy meal. To be really effective, healthy habits have to be part of your routine. Exercise can reduce your blood sugar surprisingly quickly. Of course, if you eat too much in an effort to prevent hypoglycemia, your blood sugar can go too high. When exercise is fun and your friends or family are part of it, and when you start at a level that's right for you and keep it regular, you have the formula for success. A healthy heart. In evaluating your risk of developing heart problems, doctors look at your age, family history, smoking habits, weight, cholesterol level, blood pressure, and other factors. I believe, however, that it is prudent to act as if you are at risk, even if none of these factors apply to you. Here's why. Most people in North America and Europe have already developed artery blockages, the beginnings of heart disease, by the time they reach early adulthood. Having diabetes increases that risk. Rather than wondering, am I at risk, it is safe to simply assume that you are, and to take action to protect yourself. Some evidence suggests that your heart is assaulted especially hard by smoking, high blood pressure, and high cholesterol levels, while your small blood vessels, such as those in your eyes and kidneys, are especially sensitive to high blood glucose levels. Cholesterol is a raw material, and your body makes many things from it. Believe it or not, cholesterol is used to make certain hormones, including testosterone and estrogen. It is also inserted into the thin cell membranes that surround each cell in your body, and it acts as a kind of glue to hold the membranes together. Without it, you would collapse into a gelatinous heap. When too many particles of cholesterol pass through your bloodstream, they create a different kind of congestion. The circulating particles can easily become damaged. When they do, they spark the formation of raised bumps called plaques, which are very much like small scars on your artery walls. Now, this is dangerous because plaques are fragile. They can crack or rupture, and when that happens, the blood around the plaque starts to clot. The growing clot can fill the artery like a cork and stop blood flow. If that happens in an artery that carries blood to the heart, a portion of heart muscle will die. That's a heart attack, which doctors call a myocardial infarction. Just to clarify, cholesterol and fat are two different things. Cholesterol is a microscopic ingredient in cell membranes, as described above, and is present in all animal cells. The fact that bacon grease is solid at room temperature is a sign that it is loaded with saturated fat, which you can think of as bad fat because it raises your cholesterol level. All fats are mixtures. Beef fat, for example, is about half saturated fat, with the rest being a mixture of various unsaturated fats. Chicken fat is about 30% saturated fat. Fish vary from about 15 to 30% saturated fat. Vegetable oils are much lower in saturated fat except for the tropical oils. Coconut, palm, and palm kernel oil are all high in saturated fat. Some food companies alter vegetable oils through a process called hydrogenation, which makes them similar to saturated fats. The resulting fats, called trans fats or partially hydrogenated fats, are solid and have a long shelf life. Unfortunately, their effect on your cholesterol level is similar to that of butter or lard. All meats, even lean meats, contain cholesterol ranging from about 10 milligrams in every ounce of tuna to about 50 milligrams per ounce of shrimp. Chicken and beef are in between, with about 25 milligrams per ounce. And yes, cholesterol in foods does pass into your bloodstream. Saturated fat causes your body to make cholesterol. There is no cholesterol or animal fat in any food from plants. That goes for every fruit and vegetable, every bean, every grain, every variety of rice, pasta, and potato, and everything made from them. To me, a plant-based diet was a world of new tastes and was anything but austere. Having repeatedly studied how people react to different diets, I am convinced that a vegan diet is actually easier to follow than most other diets. This is partly because of its simplicity. Like quitting smoking or freeing yourself from any other habit, setting aside unhealthy foods is easier than teasing yourself with small amounts of them day after day. And the diet's benefits are usually so rewarding that you want to stick with it. Oats, beans, and barley contain soluble fiber that reduces cholesterol levels. I do not recommend that you make nuts a regular part of your diet, however. Despite their cholesterol-lowering effect, they are so fatty that they will make weight loss difficult and may interfere with your efforts to improve insulin sensitivity. Fruits and vegetables are not only cholesterol-free and very low in fat, their beta-carotene, vitamin C, and vitamin E can actually reduce the damaging effects of cholesterol in your blood. Here's why. As cholesterol particles glide along in your bloodstream, those that enter artery walls and cause plaque buildup are the ones that have become slightly damaged or oxidized. Beta-carotene, vitamin C, and vitamin E actually protect the cholesterol particles from damage, so they go on their merry way without harming you. Read the labels on packaged foods. If you spot animal products or partially hydrogenated oils in the ingredient list, you will want to avoid that food. And if there are more than 2 to 3 grams of fat in a serving, skip it. The cholesterol in high-density lipoprotein HDL particles is called good cholesterol for only one reason. It is on the way out of your body. HDL particles scour your artery walls, picking up cholesterol and eliminating it like tiny sanitation trucks carrying away garbage. Triglycerides is a technical term for a fat in the bloodstream. Lowering triglycerides is a good idea as it will reduce your risk of heart problems. It is usually easy to do. A low-fat plant-based diet is a good start. But take one additional step. Avoid sugar, white bread products, and other high GI foods. If you could look at a fat molecule under a powerful microscope, it would look like a long chain of carbon atoms with perhaps 18 or 20 atoms joined in a line. Attached to the carbon chain are hydrogen atoms. If the chain is completely covered, i.e. saturated, with hydrogen atoms, the fat becomes a waxy solid and is called a saturated fat. If, however, hydrogen atoms are absent at several spots on the fat chain, the fat is called polyunsaturated. Polyunsaturated oils are liquids. And if just one spot on the carbon chain has no hydrogen atoms attached, the fat is called monounsaturated. The word triglyceride is derived from the fact that when your body transports fat molecules from one place to another, it generally attaches 3 fat molecules to a glycerin molecule, hence triglyceride, before sending them into the watery environment of the bloodstream. Healthy nerves, eyes, and kidneys. People with diabetes are at risk of nerve damage, which can take 2 forms: Peripheral neuropathy, sometimes called sensorimotor neuropathy, is damage to the nerves that allow you to feel things or to move your muscles. It leads to tingling, pain, numbness, or weakness in your feet or hands. Autonomic neuropathy is abnormalities in the nerves that control your internal functions. It can lead to digestive problems such as nausea, vomiting, constipation, or diarrhea. It can also cause problems with bladder control or sexual function. Other symptoms include dizziness, faintness, increased or decreased sweating, visual difficulties, for example problems adjusting to light and dark conditions, and lack of awareness of the warning signs of low blood sugar. If you are low in vitamin B12, you can have nerve pain that is indistinguishable from the nerve symptoms of diabetes and can end up being permanent. Protecting your eyes means keeping your blood glucose, blood pressure, and cholesterol under control. 3 parts of the eye are particularly vulnerable. First, pressure can build up in the front part of the eye, called the anterior chamber, and eventually damage the retina and optic nerve. This is glaucoma. Second, a cataract can compromise the lens's clarity. Third, blood vessels in the retina can become damaged. Most people with diabetes eventually develop at least a mild degree of retinopathy. Your kidneys are made up of millions of tiny filtration units. They purify your blood, sending waste products out into the urine and holding onto the proteins and other normal blood components. But just as the retina's tiny blood vessels can be damaged, so can the tiny vessels in your kidneys. High blood pressure, high blood glucose, and high cholesterol assault them, leading to a condition doctors call nephropathy. Left uncontrolled, kidney damage can progress to the point where your options boil down to dialysis or kidney transplant. This is the end of my presentation of the highlights of Reversing Diabetes by Dr. Neil Barnard. I hope you have enjoyed it, and please leave a like if you did. Namaste.